You've considered doing a breast implant surgery, but you're a little confused about how the sizing and the profiles work. Good morning, my name is Dr. Amit. I'm founder director of Divine Cosmetic Surgery, and one of the biggest pain points that most patients have is about the size. How do we determine the size? Of course, today we have AI generated softwares which allow you a better choice, but in the end, it is the human touch, the human mind, and the skills which make all the difference. So let's try to understand this a little better. The first thing that we do is measure your base diameter of the chest. We take an assessment of the base diameter, make an assessment of the looseness of skin, how lax the skin is, how much of an, how much, if we pull the skin, how high it will go. If it's a very firm skin, then we can't use a large implant. If the skin is a little lax, then we can use a large implant. So I'll give you an example of this. Now, I've put the tape here at 10 centimeters. I'm assuming that the base diameter is 10 centimeters because we take any implant, the implant will sit on the chest, and this implant has to be on the breast, and the center of the implant has to be the nipple region. Therefore, if this diameter is 10, then we see this as base 10. We place the implant here. Now, suppose the base diameter is 10, but the patient wants a big breast. What do? We find an implant which has a higher projection. So, we find an implant which is higher projection at the same base diameter. That means an ultra high profile. Different companies have different profiles, so it is the choice of the doctor to choose the profile that is best for you. Let's consider another scenario. Suppose the breast is very tight, skin is very tight, young girl, then we are not able to put a very high profile implant. So we have to explain that this is the maximum that you will get. So the first deciding factor is the base diameter of the implant, which is this. Then the projection. The projection, if it is ultra high, is able to give a bigger breast. If it is high profile, it gives a slightly smaller breast. If it is moderate profile, it makes it even smaller. So this is how we decide on the size of an implant.